All right, welcome back, beautiful people. This is Forever Young. I'm Dr. John Layke.
And I'm Dr. Payman Danielpour.
Today is going to be kind of an interesting topic, and it's something that we do on an annual basis. But the statistics for the American Society of Plastic Surgery, surgical statistics, has been released for 2022.
And it's going to blow your mind.
Yeah, listen, it surprised us as well, and we're in the field. And so, we'll kind of talk about some of the top procedures, the top trends in both cosmetic, non-invasive, and reconstructive, and kind of give our insight as to why this is happening.
And the numbers really come from, so it's pre-pandemic numbers, 2019, and then 2022. And what we're going to do is we're going to kind of go over all of the different procedures, and you know that our practice pretty much does most of these procedures, so we can tell you how we feel about it as well. But I find these numbers to be just fascinating in the sense that they're all up pretty much.
Yeah, listen, I'll preface the entire conversation by saying that as far as cosmetic surgical procedures, from 2019 to 2022, there was an overall 19% increase. That is a significant number. And we'll kind of break that down and go over why we think that some of these are happening in certain areas. But I thought you could kind of talk about the breast and body. I'll go over the face. It's interesting to me. So, as far as you can set the drum roll for the top 5 cosmetic surgical procedures.
And it seems like the number one is always the same. Always the same every single year. What do you think it is, guys?
Liposuction. It holds the top spot for the second release in a row. And so, we haven't really had the statistics since that time. And so when we know that liposuction ultimately sculpts the body, and this is for all comers, male, female, top is number one is liposuction.
Absolutely. And then moving along, and
near and dear to your heart.
Dear to my heart. And even though there's been so much news about breast implants and how a lot of people are getting their breast implants removed, hey, breast augmentation's still up there. And it makes the top 5 and takes it number 2. And this has been one of the most really popular procedures for all plastic surgeons since 2006. Now, the one thing we talk about all the time is how the devices keep getting better and better and better. So breast augmentation is up there, and this includes breast augmentation with a lift, without a lift, and everything else. So that it just gets all lumped up in one.
And number 3.
Another one that I love doing, but we love doing together, which is a tummy tuck, also called an abdominoplasty. And again, always, the tummy tuck procedure always continues to be one of the most favorite procedures. And I always tell patients that come into our office, it's not necessarily just a cosmetic procedure, because it's really just restoring a pre-pregnancy body. And I love it because I love working with moms because they have babies and they just want to look good again. They want to look like they did before. And that takes number 3.
Yep. And that's, again, grab the same spot or a top 5 for a second year in a row. And so we know that these are just incredibly popular procedures. And number 4.
Number 4, I did one yesterday, and we love doing these also in the practice, is a breast lift, also known as a mastopexy. Just basically restoring a youthful breast after breastfeeding or weight loss, or just general effects of aging that happen and make a breast sag. So a breast lift takes number 4.
Yeah, commonly included in our mommy makeovers. And so
absolutely,
again, it goes back to that mom wanted to go back to a pre-pregnancy state. They want to lift their breast back up after breastfeeding, and tummy tucks go along with it. Number 5, more in my wheelhouse. This is eyelid surgery. So it returns to the top 5 this year. And, eyelid surgery includes removing excess skin, fat, or muscle from the upper or lower lids, and sometimes both, to reduce that droopiness or puffiness around the eyes and make you appear refreshed. And I think it's one of the most important facial rejuvenation procedures because it's the first thing everybody sees. That's how you greet someone.
Completely
you make
agree.
eye contact, and ultimately that is what can make us look older. Then we flip around to the other areas of the face, but number one will always be the area right around the eye. So,
and interestingly enough, some of these procedures, and we do it in our practice too, an upper eyelid procedure can literally be done in 20 minutes under local anesthesia. For some people, if it's the only thing that's bothering them, just a little bit of extra skin of the upper eyelid, that could be taken care of very easily. When I saw this report from the American Society of Plastic Surgeons, the one thing that really kind of popped out at me was this increase in chest and core cosmetic surgical procedures over the pre-pandemic reported data. So 2019 versus 2022. And listen to this. This is actually really impressive. Breast reductions went up by 54%.
Crazy. And that's for aesthetic purposes only. This is not even talking about recon.
That's really, they're just talking about when I saw this chest and core cosmetic surgical procedures, 54% for breast reductions, 37% for tummy tuck, 30% for breast lifts, 23% for liposuction, and 4% for breast augmentation. Those 5 procedures, they really popped. And I think, this is my take on this, and I could be wrong, I think people did so much facial surgery during the pandemic because they could hide out, whereas they couldn't do as much of the body stuff because their kids were at home with them and they had to be with their kids. Because a lot of these procedures that I'm talking about when it comes to tummy tuck or breast lift is for post-pregnancy patients. So I think that's why it went up so much more, or at least that's my thought.
Well, I thought it was really interesting for all of you BBL lovers out there, the Brazilian butt lift, is that there was an 86% increase in the buttock lift. And this is what we've talked about in multiple previous podcasts. If you look at our downsizing podcast, this is where what happens when you jam fat into the buttock and it expands and stretches out that skin. Once that fat slowly goes away, what are you left with? Sagginess, just like the breast. And so now an 86% increase in the buttock lift. So I thought that was amazing.
And another thing that I saw, and again, we're going to go through a bunch of numbers with you guys. I think some of them are really fascinating. What I talked about earlier with liposuction and tummy tucks and just doing body work, 77% increase in cryolipolysis. And so we're saying cool sculpting went up by 77% since over the pandemic year of 2019. Now, could it have been because people weren't offering it, people were going in the office, or could it be that people gained a bunch of weight and wanted to have non-invasive procedures? But it goes to show you that cool sculpting and non-invasive procedures are still really at the forefront of aesthetic medicine. Over here it says there's a 22% increase in non-surgical skin tightening since 2019. So people are doing invasive and non-invasive procedures. Now, let's just go over some more of these numbers that honestly I'm looking at, and I think it's really, really fascinating because in the news there's a lot of buzz about breast implant illness. There's a lot of buzz about breast implants causing cancer or having other issues. And again, if you ask me, I think breast implants are very safe. I use them all the time in the appropriate patient. I thought that I would look at these numbers and I would think there'd be a huge uptick in explants. And there really isn't. Listen, there's some, it was 12%, but it wasn't a amount. I thought it was going to be like 50%. I thought it was going to be even more because there's so much news about it.
Yeah, listen, I think you have to understand there's almost 300,000 breast augmentations, and it was only up 4%. And so,
yes,
we have to take that into consideration because there may be kind of a plateau in that area. However, 300,000 procedures is still a significant amount,
still
right? It makes the top 2. And so, when we look at breast implant removal, it's up 12%, but that's 37,000 cases of explantation.
True.
And again, these are only the reported numbers. So I think I agree with you. I would have expected it to be, much higher. But I think the media is blowing up the significance of breast implant illness. And so, for the people who feel that they've been affected by it, it's a much smaller subset than is actually. And listen, it's not the first time that the media has blown up something that's trivial and turns into something a larger magnitude. So, but I thought it was interesting that almost 300,000 breast augmentations and 143,000 breast lifts. I mean, that's significant for cosmetic surgical procedures. In total, there's 575,000 cases a year. That's a significant amount.
Absolutely. And then let's move along to body. And then I'm really fascinated with the facial numbers because we'll go over that. But when you look at the overall cosmetic surgical procedures that were done on the body, most of them were up. The buttock lift, like you said, was up 86%. And that's for its own reason, because the trend is now going away from having a very large butt to having more of a nice shape to the butt and not as big. And
you see it only went up 2%. The BBL went up 2% as opposed to the buttock lift is 86%.
And if you looked at it from, I think, 3 or 4 years ago, it was up significantly more. Now, let's look at a few things that went down. And my least favorite procedure as of a couple days ago is a thigh lift. And it's gone down. Now, the question is, why? Is it because people just are shying away from this procedure because it has complications? The scars don't look good. You can have wound dehiscence. You can have seromas. It's just one of those procedures that nobody loves to do as a plastic surgeon, but people are still having bariatric surgery. Now with Ozempic, people are losing a ton of weight. I wonder what is going on with the thighs.
Yeah, I'm wondering if there's just more non-surgical or minimally surgical invasive options, or minimally invasive surgical options, like using radiofrequency, some of the external things like Morpheus 8 and tightening up some of that skin. A lot of people used to undergo thigh lifts just because they wanted to reduce some of the cellulitic appearance, and I think that, now if you can tighten up some of the skin and reduce some of the fat, even non-invasively, it works out well. So,
and then I looked at one other thing that I thought was actually pretty fascinating in the sense that the buttock implants, look at the number of buttock implant cases that were done compared to all the other procedures.
Yep.
And it's one of those procedures that we don't do in our practice. And we actually tell people that it's wrought with complications.
So he's talking about there's 1,164 buttock implant cases.
I mean, think about, we just talked about there was 300 breast augmentation cases.
300,000.
So 300,000 breast augmentation cases in which we put implants in the breasts. So somebody comes in and has, not enough volume in their buttocks or buttock ptosis or wants to add. First thing you think about is fat. You don't think about putting an implant in. And obviously, there's a huge difference. There's a 25-fold difference between fat grafting to the butt versus putting a buttock implant. And that number right there should tell you, hey, listen, guys, it's pretty much one of those procedures that most plastic surgeons don't want to do because it does have a high complication rate.
I have a feeling that when 2023 stats come out, that we have seen the peak of the BBL and we're going to see the buttock lift go up. But that's just my opinion.
Absolutely. And the other number that I was a little bit shocked with was labiaplasty, because labiaplasty has gained a lot of popularity. It's a relatively straightforward procedure. Again, not that I do it or you do it because it's not in our wheelhouse, but people do it. But it's gone down by 7%.
I think probably because of radiofrequency devices. Again, external skin tightening, things like that. When we come up with newer technologies, they will slowly replace some of these less desirable procedures. And I think that's, kind of the goal behind those. So
very, very well said. I actually was thinking about that. I'm like, why did it go down? But that's probably what it is, because there's so many different devices now that can be used and you don't have to have surgery.
I thought it was pretty interesting that the total number of cosmetic surgical procedures for the breast almost equaled the number of cosmetic surgical procedures for the body. Both are around, for breast, it was 575,000, just over that. And for body, it was 576,000. And it goes to show a lot of people are starting to do combination procedures. And so when we add, the mommy makeover to the mix, you're doing, breast and body at the same time. So I think that's where these numbers are coming from. But it's interesting how they both parallel. It just goes to show that people feel more comfortable doing multiple things at the same time.
Absolutely. And let's move along.
Pure speculation, but
Tell me.
Again,
I think it's true. I mean, we see it ourselves. I mean, think about it. We see the gamut of all of it, and then we see how people keep. Oh, I'm having my breast done. Is there any way Dr. Layke can do my nose at the same time? Well, how often do we do that? All the time.
Sure.
So it is a very viable option for people to do multiple procedures at the same time, get it done, so they don't have to do it again.
So now we get down to the cosmetic surgical procedures for the face. And I thought it was pretty interesting. Overall, there was an 18% improvement or increase in procedures. In particular, the rhinoplasty or nose surgery, nose job surgery improved or increased by 37%. And I think a lot of that had to do with the fact that during the pandemic, people were wearing masks. We had downtime. And so it made it much easier to convalesce through that procedure without people really knowing. The numbers are a little skewed only because cheek implant, or we call it malar augmentation, went up 150%. And so it's skewing some of those numbers. But at the same time, ear surgery, otoplasty was down 43%. Forehead lifting and facial fat grafting, I thought that was really interesting. Facial fat grafting went down 8%.
That number's off. I don't believe it.
Yeah, I mean, listen, but I think, it could be with the trend towards the deep plane facelift that many people feel that further fat grafting may not be necessary. I still do in the appropriate individual. I still think that volume loss always plays an issue, and you can resuspend and retailor where certain parts of the anatomy should be, but we do lose certain fat pockets as we age, and so to refill those to where they were, I think gives you a much more natural appearance.
And I agree with you, these numbers can be skewed because if you look at the numbers and you look at facelift surgery, it's up by 8%. But then you look at neck lift surgery and it's down by 6%. Generally speaking, most people that get a facelift, they get a neck lift as well. There's a very small subset of the population that will just get a mid facelift. Most people that have an aging face, they also have somewhat of an aging neck. So they want to fix their jowls, their platysmal bands, the sagging skin from the neck. So that to me doesn't make sense, but perhaps it's just the way the numbers were obtained.
Yeah, listen, I think you have to take with a grain of salt when they list out these statistics that there is a certain subset or population that is responding to the questionnaires that are being asked, right? And so, whether there is, the total of, if we look at the percent of total number of cases that are actually reported, it's obviously going to be much lower than what happens. And so it's kind of like, the electoral votes, we see them come in at the end and you say, well, these haven't been reported yet.
Very true.
And so it can skew the numbers. But
what, out of all of these, when you look at the facial numbers, what to you pops the most?
I mean, listen, rhinoplasty, that was by far at 37%. We'll see what the numbers are for next year. But I think we see more on social media. We see the potential and what can be done. And so people are less likely to shy away from these procedures.
Absolutely. And I do think, like what you said, I do think some of this is skewed because you look at this and there's no real brow lift. It just says forehead lift. And then it says eyelid surgery, which is lumped into upper and lower. So they're not, very specific, but it's really fascinating to me that it's gone up by as much as it has. And the real question is, and when you think about some of it, what's the driving force? Why is this happening? Is it people have more money because they didn't travel? Is it more just socially accepted because you have celebrities that talk about it and TikTok trends and people are out there? Is it more that we've noticed, hey, the better you look, the more you're kind of setting yourself up for a better job or better partner, or and I think it's a bunch of them, but I do think it's something that we should discuss.
Yeah, listen, I think those are all valid points. And so when we look at these trends, I think, again, it goes to that age-old adage, you look good, you feel good, you do good, and that's been proven time and time again. And so I think that these data points just confirm that.
And also things have changed, like the world's changed, right? So over the last 3 years, there was a huge shutdown and people still aren't fully back at work. So how does that help this And why does it help? Well, it helps a lot. If you can imagine, we just did surgery on somebody on Tuesday morning. And when I went and saw him before we did surgery, I said, so when are you going back to work? He goes, I'm not. I work from home. Don't worry about it. As long as I don't look too banged up, I can actually do all my Zoom calls, do as much liposuction on my body as you want. And that's become something that's very common, especially in California. A lot of the people going back to work has been in a very staggered manner. They go maybe some days, they don't. So for somebody who's having surgery, it's great because they can convalesce. Nobody will know. They'll even take off a little bit more, stay at home, and then do it. So I think there are a bunch of different things. And I think you and I see this a lot because we're in the wellness space. Everyone wants to feel better. Everyone wants to exercise more. Everyone wants to look better. And it all kind of goes hand in hand. So you can do as much as you can from your end, exercise, maintain a healthy lifestyle, but there's some help that you may need, and that's where we come in.
Well, listen, now we're going to move over to minimally invasive procedures, and it is staggering, the numbers. But,
it's insane.
If we look at the top 5 cosmetic minimally invasive procedures for 2022, it is and has been for several years, but neuromodulator injections. So Botox, Dysport, Xeomin, and Jeuveau. This procedure works by essentially stopping the facial muscles from contracting and gives them temporary smoothness. And I think is probably one of the most powerful drugs that we have to slow down and reduce the signs of aging.
Without a doubt.
And that is the number one most common procedure. Number two is soft tissue fillers, HA fillers. So, second in popularity are things like hyaluronic acid fillers, Juvederm, Voluma, Volbella, Volure, Restylane. There's a bunch of them. Yeah, tons of different
And really
types.
what this is very different than Botox and not neuromodulators. What this does is it'll fill lines or add volume. So people that don't want to undergo facial fat grafting, people that don't want to have a facelift, that just look like, my cheeks have been descending a little bit. I need a little more volume in my cheeks, a little more volume in my lips, maybe a little bit in my laugh lines or my marionette lines. This is a great way to kind of, push off surgery, make yourself look a little bit more rejuvenated without having to do a whole lot.
Number 3.
Oh, wow.
Skin resurfacing. And these are any procedures that either remove the top layer of skin in various ways. You stimulate collagen, and you are looking to get a more youthful and radiant complexion. And that's in the form of either a dermabrasion, a chemical peel, lasers, or microdermabrasion. And so, again, anything to improve the quality of the skin. And I think that these are going to become even more important just because we see the importance of skin in looking younger. And so I think those numbers will continue to trend.
And the technology just keeps improving, which is really amazing as well. So there's certain things we didn't have, I don't want to say 3 years ago because we had most of these things 3 years ago, but we didn't have 5 or 10 years ago. So things will keep getting better, and we can do non-invasive procedures to really slow the progression of aging. So skin surfacing procedures come in 3.
Number 4.
Number 4 are skin treatments that I just almost jumped ahead. Skin treatments this is lumped into a bunch of different things. It would have been better if they would have separated them, but they didn't. So this is basically skin treatments to solve a variety of different problems. So combining laser treatments to tighten skin and remove spots, or basically doing intense pulse light to improve skin tone. This also actually put in tattoo removal and a bunch of other things as well. And actually, if you look at it, it says laser hair removal, IPL treatment, laser tattoo removal, laser treatment of leg veins. So it's a bunch of different types of non-invasive.
Yeah, it's interesting that they separated these two categories of skin resurfacing and skin treatments because a lot of it bleeds into, there's a lot of gray area there. And so, although there are people that come in and just want to target brown spots, they really want better texture, and uniform color to the skin. So it's interesting to me.
And it's the same with the next one too, like you said.
Yeah, listen, when we talked about soft tissue fillers as being number 2, then lip augmentation, they actually separated out. And so this procedure obviously has been growing popularity for the last several years, and it's augmenting the current existing shape of the lip, sometimes creating more of a shape. And this is all using hyaluronic acid filler or fat or something like that. But it's interesting that they separated this from the soft tissue fillers because lips are essentially soft tissue. So
agreed. Because how often do you have a patient come in and say, I'd like to get some filler? And what you'll do is you'll put some in their laugh lines, you'll put some maybe in their cheeks, and they'll be like, can you put a little bit in the lips too? Because it's the same material that we use. So it should be kind of lumped in, but it's not. But it's still fascinating that non-invasive procedures have gone up so significantly. And I think next year and the year after and the year after that, they're just going to keep going up exponentially.
Yeah, listen, I think, some of the data is a little spotty when we look at pre-pandemic numbers. A lot of the things probably weren't reported or they were lumped into some of the other categories and now they're being stratified. And so it's not really a fair assessment. But I thought what's amazing is when we look at all the total of all minimally invasive cosmetic procedures, we've got 23,672,000. I mean, that's just an incredible number. And again, you have to keep in mind that this is a percent of the actual procedures being performed because not everybody's responding to that survey.
And also remember, this is only by people that are part of the American Society of Plastic Surgeons, most likely board certified plastic surgeons. So all your nurse injectors, all of those non-boarded cosmetic surgeons, and all the other people, all the other doctors that are doing Botox and wrestling, none of that's in here.
Yep.
So I guarantee you, if you put those numbers in there, they may even double.
Yep. Absolutely crazy.
Moving along to something we'll kind of just touch on for a minute because we are reconstructive surgeons. The 2022 reconstructive statistics.
Yeah, I thought it was interesting from 2019 to 2022. Overall, there was actually a 3% drop. And I think that when you look at burn care and cleft lip and palate care and hernia repair and laceration repair, they're all negative numbers. I think these statistics are inherently flawed.
Yes,
now,
I agree.
If you looked at it as a purist and you took the numbers, you could say, well, a lot of plastic surgeons are now trending more towards cosmetic surgery than they are reconstructive. And so I think that may be the case. Most reconstructive plastic surgeons either only deal with breast cancer reconstruction, or you're just in burn care, or you're in head and neck reconstruction. I mean, these are massive cases, free flap. And the only thing I could say, again, as a purist, would be that more plastic surgeons are transitioning from their reconstructive practices over to cosmetic surgery just because insurances aren't paying and, it's a long and arduous training.
And I'll just hit on the top 5 just so you know it.
Yeah.
But again, I agree with Dr. Layke. I think that this is fully flawed because I think that, and I do think that they should lump things together. Treatment of dog bites should go into laceration repair. And there's a lot of different things. But just so you guys know, number 1 is tumor removal. It's kept its spot for many years. Second is hand surgery. If you guys didn't know, and if you haven't listened to our other previous podcasts, plastic surgeons are all trained in hand surgery. Dr. Layke and I are also hand surgeons. We don't do a ton of it anymore, but we did a lot of it. A third one is breast reconstruction. This actually appeared for the first time in the top 5, and it's one of the numbers that have gone up, but I think this has to do with what John just said, and I think more surgeons reported that they do breast reconstruction than they, I don't think they have their numbers of dog bites and laceration repairs.
Yeah.
And then the maxillofacial injuries and scar revision. And I think scar revision has dropped 2 spots, mainly because of what you said earlier. I think more non-invasive and lasers are being used for treatments of scars, and scars don't have to be cut out as much because we've realized that sometimes if a scar heals a certain way and we cut it out, it may heal exactly the same way. So let's throw a different variable. Use a laser, use Morpheus, use injectables.
Definitely. More exciting episodes just like this. Watch here now.
And it's a horrible thing to talk about because it's really scary. But as you're washing your face with forever chemicals, and forever chemicals are forever, and they do not break down.